Dave is one of the senior most anesthetists of our area.
It's great to see a gathering of so many doctors on a Sunday morning. We all know what it takes to get out of bed on a weekend, and that too to hear some lecture on lifestyle disorder. So let's make it worthwhile by pondering over certain issues which we are bothered with in our day-to-day practice. Today, I'm going to talk on obesity in general population, obesity amongst physicians, and role of physicians in anti-obesity campaign. Let's do some self-analysis by asking ourselves some questions. Physicians, have you ever asked yourself these questions? What is my BMI? Do I fall in obese category? Should I take any treatment for obesity? Do I look at obesity as a problem? Do I look at it as a cosmetic problem or a disease? Do I refer my patients to be treated for obesity? How much health conscious am I as a health provider? After doing this self-analysis, we can introspect about how much we know about obesity and what we are doing for ourselves. There was a study conducted in 2004 long ago which said that 44% of the physicians were overweight and 6% were obese. I'm pretty sure that if such a study is conducted now, let's say in the metro of Mumbai, 44 must have gone to something like 64 or 74. So let us understand obesity better. Obesity by definition is excess of fat storage rather than weight, which could be excess muscles. Men with more than 25% of total body fat and women with more than 30% total body fat are considered as obese. World Health Organization has classified obesity as a disease. It is now called as globesity as it has become pandemic. These are the parameters to assess obesity. The very common is body mass index, which is weight in kg per height in meter square, waist circumference. Women with a waist measurement of more than 35 inches and men more than 40 inches may have a higher chance of disease than people with smaller waist measurements. Waist to hip ratio. Males with a waist to hip ratio of more than 1, while females of more than 0.85 are at a high risk. Skin fold thickness. This refers to the measurement of subcutaneous fat located directly beneath the skin by grasping a cold skin and subcutaneous fat and measuring it using a caliper. What are the causative factors of obesity? Excessive weight gain is primarily because of 3 factors: diet, metabolism, and activity. Diet largely depends upon socio-cultural background, biomedical condition, mental condition, and if the patient is on medication. The same factors will affect the activity of the person, resulting in the weight gain. Socio-cultural, biomedical, mental, and medication affect diet and activity both. While metabolism depends upon the age, gender, genetics, hormones, skeletal muscle, and again medication. These 3 play as an interactive role in either weight gain or weight loss. Is obesity a lifestyle disease? Yes. Eating too much is a habit and a lifestyle problem. Most doctors do not call it a disease but a problem. I want to make a very important statement here. It's a result of an inappropriate relationship of people with their environments. A lifestyle disease is a disease you're not born with, but it resulted with risk factors like sedentary jobs, wrong eating habit leading to lack of energy balance, lack of sleep, stress, inactive lifestyle, alcohol and smoking. Let's look at some of the facts and figures which would shock us. WHO projects that by 2015, approximately 2.3 billion adults will be overweight and more than 700 million will be obese. 70% of the Indians in megacities are overweight and obese. As per the BMI, about 54% are obese, 19% are overweight and 27% are normal. In major cities in India, almost 80% of the people had abdominal obesity or a waist circumference of over 90 centimeters. WHO estimates that there are 5 million overweight children worldwide, and between the age group of 5 to 14, 50% of the children did not possess an ideal BMI. BMI and death rate. Being obese can shorten life up to 10 years. BMI above the health range increases the risk of early death by about 30%. There's a 40% more risk of heart disease, 16 to 120% higher risk of dying of diabetes and kidney failure, 10% more risk of fatal cancer, 20% risk of failed lungs, and severe obesity in 40 to 45 BMI range cuts the lifespan of 8 to 10 years, comparable to the effects of smoking. So now let's look at the treatment of obesity, which is fourfold. One is lifestyle modification by diet and exercise, the most popular method. Bariatric surgery, which is getting popular. Cosmetic surgeries like liposuction and tummy tuck. And non-surgical treatments. When we talk of lifestyle modification, the first and the foremost thing which comes to our mind is caloric restriction. I think even a child knows that if you're obese, you have to cut down on your eating. A caloric restriction is a dietary regime that restricts calorie intake. These are divided into two basics. One is the LED, that is a low energy diet, which ranges from about 800 to 1200 kilocalorie diet, and a very low energy diet that goes up to 500 kilocalories. It may appear very less, but it is very effective. And it is given in the form of nutrition powders or in the form of proteins, minerals, trace elements, and vitamin-enriched formulated meals. And the behavior modification, which is yes, dietary intervention. We tell the patients to take small, frequent meals and physical activity. Today, every nook and corner there is a gym, and everybody is almost enrolled with some or the other gym once in their lifetime. Let's look at the different surgical procedures used for obesity. We all know about bariatric surgery, which includes gastric bypass, sleeve gastrectomy, intragastric balloons, vertical gastroplasty, and gastric bands. Cosmetic surgery such as liposuction, tummy tuck, abdominal lipectomy, and liposculpture. Now let's look at something which is getting very popular, non-surgical obesity treatments, which are extremely safe, effective, there's no pain, no cut, stitch. This is specially indicated for patients when they have done extreme diet, exercise, but they are not able to get those inches off certain resistant body parts like hips, thighs, and abdomen. Or you may have patients who are not able to do diet and exercise because of certain conditions, like suppose a patient is having osteoarthritis of knee and is not able to do any exercise, or a diabetic who is not able to do any drastic diets. Or you might have some patients whose occupational requirement is to remain like a model, or a film star. In such patients, non-surgical obesity treatments are like a boon, where there's a precise body contouring is done with the help of certain technologies like high-intensity focalized ultrasound, endomology, and mesotherapy. We will now go into the details of how it is done. High intensity focalized ultrasound is a French technology. It was originally devised in France, where they were using it to destroy the tumor cells of prostate and breast. Later it was also used to treat uterine cancers. Then it was modified to destroy the fat cells to combat obesity. High intensity focalized ultrasound waves are focused up to 1.5 centimeters below the skin to permanently destroy the fat cells. It applies focused therapeutic acoustic waves for selective lysis of adipocytes using a predetermined amount of ultrasound energy across the subdermal fat layer. The ultrasound waves generate a mechanical effect in the confined focal volume, causing fat cell membranes to rupture. The mechanical effect ensures that only adipose fat tissue within the targeted area is disrupted. The surrounding tissue, which consists of blood, lymph vessels, skin tissue, and peripheral nerves, are not impacted by the process and it remains intact. In the diagram, you can see a concave probe. What happens actually, a chemical reaction in the fat cell is depolymerization or molecular dissociation of triglycerides and increase in the fluidity. Lipolysis or rejection of fatty acids from adipocytes is made via a stable cavitation phenomenon and by increase of the permeability of the adipocyte. Defibrosis by the mechanical action of the connective tissue in the hypodermis. This is a diagrammatic representation of what happens at the cell level. You can see the first action, which is a molecular dissociation of the triglyceride and lipolysis and defibrosis, and the second action, where this fat is liberated in the interstitial tissue, which is evacuated via natural lymphatic drainage. These are some of the histopathological pictures where you can see the treated and the untreated fat cells, and also a photograph of ruptured cell after ultrasonic treatment. You can see the fat coming out. The second common treatment which we use is endermology. Endermology is the first treatment approved by the US FDA to allow temporary reduction of cellulite for reduced body measurements, increased circulation, relief of muscular pain, and reduction of muscle spasms. It's a massage machine with two rollers and a gentle suction action that, when rolled over the top layer of the fat, makes a fold. This folding action stretches the connective tissue and results in the reduction of cellulite and body measurements. Endermology is an effective detoxifying drainage for revitalization and oxygenation of tissue. It reduces bloating of water retention and dissolves fat by lipomobilization. It gives dramatic effects in reshaping and contouring very difficult areas of the body. So many times I have patients coming to me with a perfect BMI, but there are certain areas like especially thighs and the lateral sides of the thighs in females. You just can't get rid of the fat over there. Endermology really makes wonders over there. Another very popular treatment in Europe and USA is mesotherapy. Mesotherapy is of two types, invasive and non-invasive. This medical specialty targets problem areas with micro-injections of conventional or homeopathic medicines, vitamins, minerals, and amino acids. Tiny medical bullets are delivered directly into the mesoderm, which is the middle layer of the skin, that are highly specific to the condition being treated. Various mesotherapy solutions are involved. The customized mixture of vitamins, amino acids, and medications